In 1968, Dr. Shinya successfully developed the technique of colonoscopy in order to visualize the entire rectum and colon. The following year, in 1969, he devised a snare cautery device and was the first to perform colonic polypectomy through the colonoscope. He has performed approximately 300,000 colonoscopic examinations and has noted that there appears to be a strong connection between intestinal appearance and lifestyle-related diseases. This video depicts a variety of different intestinal views, good and poor, related to various colonic and other diseases. He emphasizes the importance of lifestyle and healthy eating habits, which are critical to longevity and maintaining optimal health. This is a 45-year-old female. Her intestine is very soft, easily inflated by air, well-rounded without any residual stool or mucus abnormality. She has been on Dr. Shinya's diet for over 5 years. 75-year-old female. She has been on Dr. Shinya's diet for over 30 years. Some fecal mucus is noted in this picture, which implies she needs to drink more Kangen water daily. This is a 47-year-old Caucasian female who has been obese almost her entire life. Her diet consists of high animal proteins with very low carbohydrates and minimal vegetables and fruits for the past 3 years. Recently, she developed left low abdominal cramps and frequent bowel movements. She was diagnosed with irritable bowel syndrome. This is a 52-year-old Caucasian male. His diet is a typical American-style diet of 2 glasses of milk, 3 to 4 ounces of cottage cheese, and a cup of yogurt daily. His cholesterol level is normal with cholesterol-lowering medication, and his blood pressure is high. His prostate is moderately enlarged. This picture shows marked colonic spasm and diverticulosis. This is a 65-year-old male who has been on a typical American-style diet consisting of at least 60 to 70% animal protein. He suffers from high blood pressure with an enlarged prostate. There are numerous diverticular openings. This is a 47-year-old female. Here is a single large diverticulum of the right colon in which a 1 centimeter stool is impacted. This is a 60-year-old Caucasian male with a congenital varicose veins in the colon. There are no known enlarged veins in other organs or parts of the body. He has been on a high animal diet consisting of large amounts of cheese, yogurt, and a glass of milk a day with red meat approximately 4 times a week for the past 3 years. On this examination, he was found to have high blood pressure, high cholesterol, with a moderately enlarged prostate. Colonoscopy showed these congenital varicose veins, as the picture shows on a 3-year follow-up colonoscopy. Examination revealed a small and very early carcinoma of the cecum located over the mucosa of a prominent varicose vein. This is a 38-year-old Japanese woman who has been suffering from chronic constipation for many years. Her diet consists heavily of a Western-type menu, including white bread, yogurt, cheese, fruits, and cake once a day. She consumes 3 to 4 cups of coffee and tea a day. There was insufficient daily intake of water. She has been on various kinds of laxative every day, including Seneca, aloe, and other herbal medications for years. There are marked pigmentation and spasm. This is the same Japanese woman. She was instructed to drink Kangen water 3 quarts per day. Her diet consists of 90% grains, vegetables, sea vegetables, and fruits, and 10% animal protein with fish. Her condition has markedly improved. 45-year-old female with breast cancer. 6 months prior to this exam, she had a lumpectomy and radiation treatment. There are marked fecal retention in this picture. The same patient, following Dr. Shinya's diet, started to drink 3 quarts of Kangen water a day. Her condition markedly improved. This patient has been suffering from prostatic CA, high blood pressure, and high cholesterol. His diet consists of high protein, red meat, and dairy products every day. His colon shows narrowing and some diverticular disease and fecal retention in each segment of the colon. Same patient after prostate cancer surgery. He was placed on Dr. Shinya's healthy diet program. Although the colon revealed marked diverticular disease, his colonic appearance has improved. There is no evidence of stool retention or narrowing of the colon. This 62-year-old male had been on a typical American diet with daily consumption of red meat, milk, and cheese. This picture shows multiple diverticular openings with impacted fecal matter. He had advanced heart disease, markedly enlarged prostate, and arthritis of the legs and fingers. This is a 21-year-old Japanese male who has been suffering from marked inflammation and ulceration of the distal part of the small intestine. This is typical Crohn's disease of the small intestine. He has been suffering from frequent diarrhea and abdominal cramps for several months. Despite his dislike for milk, he was encouraged to drink milk by his parents and at his school lunches. The endoscopic view shows various size mucosal ulcerations. This is a 72-year-old Caucasian female who came in with a sudden onset of abdominal pain and rectal bleeding. Kolonoskopi showed a marked narrow, swollen, inflamed, discolored, and hemorrhagic mixture with necrotic areas. This is a typical appearance of ischemic colitis. This condition can develop through disturbance of the arterial circulation of colonic walls adjacent to blood vessels. The patient has known arteriosclerosis, heart disease, and high blood pressure. Her diet is a typical American diet with a heavy intake of red meat, chicken, and high intake of dairy products. This patient had radiation treatment for treatment of uterine cancer. As the picture shows, the mucosa of the rectum and colon is markedly hemorrhagic, edematous with capillary vessel abnormalities of the mucous membranes. Her diet consists of heavy daily consumption of cottage cheese for many years. Here is a 74-year-old Caucasian male. On colonoscopy examination revealed a polyp approximately 1.5 centimeter with an irregular surface and a heavy stem. Endoscopically, this was a typical early cancer of the polyp. The patient also has diverticulosis and fecal retention of the colon. He was a heavy beef eater and suffered from chronic constipation. The patient also complained of an enlarged prostate, heart ailments, and high blood pressure. This pedunculated polyp was excised with Dr. Shinya's snare cautery device. He has performed this type of polypectomy in 80,000 patients without significant complications. 1 hour after polypectomy, the patient was allowed to go home with instructions to avoid anticoagulants such as aspirin and bufferin. This 56-year-old Caucasian male had a very flat polyp, shown here near the large and small bowel junction.